md.gov/pathways. Nailed it.
Hold on.
Perfect.
It should be.
Is that shared with everybody else?
No.
Let's do that. Perfect. And then everybody can see it. So
There you go.
yeah, all right. Good morning, everybody. Sierra Wigfield, Senior Planner for Garrett County Government. So working on several different, lots of different projects, many hats. But I guess today we're going to talk about some of our Garrett County Pathways projects. So soon you'll, so the reports are online, but I'm working on the materials to push out the media push for the for everybody to take a look at the final reports. And the hope is that we can get those comments and then incorporate them and then adopt these plans and get them ready for next phases of funding. So I am really excited about, we have funding for two sister projects, a feasibility study connecting Oakland to Harrington Manor State Park, which is like included on the site, as well as the pedestrian connections from like Oakland, Mountain Lake Park, Laughlin Heights, and figuring out how to connect this like most densely populated area of Garrett County. So our consultants took a look at existing conditions and they have proposed a shared use path that stretches from 219 and Oak Street here all the way out to the service center. And a shared use path is like a 10-foot wide path. It's paved and it's separated by a curb and gutter and the trees or other things between that and the cars, and then in addition to the road. So I think Oak Street is probably the most limited in terms of right of way. So I think we'll see, but from there on, like once you get past that intersection of like 219 and 9th Street and 135, like there's a lot of right of way and a lot of space for this kind of facility. And right now there's just a lot of road, and the road, because there's a lot of space, people often go too fast. So this plan, I actually have a draft report and I'm going to share a link with everybody as a follow-up with Shelley. And so there's different sections that this website goes through and different solutions in terms of pedestrian crossing, but it stays along the southern side of the road. And, but I think the most interesting parts out here, once you get to the Shop and Save and out to Laughlin Heights, should we zoom out just a little bit? What do I do with this one, John? All right.
Yeah.
Just a little bit. So you have some context. So like, here's like the Leo Martin Memorial Park with the splash pad. So this would connect all this. And in addition to this, we have this network of greenways and paths that we can then further implement some like low cost improvements to make sure people who are in cars know where the people that are the vulnerable roadway users are, like our people on bikes and walking, and kind of have a dedicated space for both those users. So I'm really excited to share that. So I do think this will be a transformative project. So had State Highway incorporate their comments and make sure we're including language so then we can move to the next phase of this project. And then this project will be handed off to State Highway. And then, you know, having the support from the community and our elected officials saying, yes, prioritize this project, let's get this done, will be like the next phase and what I need from everybody in the room and our community. So I think that'll be really good. I kind of think this is a sleeper project because, I mean, you're like, well, you can kind of walk along there now, but I think once this is built, people will be like, man, how did we live for so long without this? Like, why didn't we have this facility? So I'm very excited. So it should be really helpful. And then I'm looking forward to getting some funding for the next phase, which is those that network of greenways and connecting it to the parks and the schools. And I think there's a lot of opportunities there that can make us a little less reliant on our vehicles. So that should be very exciting. And like I said, we'll be rolling out this and the Oakland to Harrington Manor feasibility study reports, letting people provide some comments and then looking for the towns and the county to adopt these plans, and then hopefully we can hand them to our partners or help them apply for future funding for these. Does anybody have any questions about this and specifically? I'll like roll through the rest of the intersections. And so I guess the most narrow one is like the bridge that they're replacing now. There would be a concrete wall rather than a curb and gutter separating them. And I guess I also have some funding for like a quick build, and we're hoping to work with State Highway on this and maybe do some just line striping or putting in flexi rods or other visual kind of barriers to see if we can see how people react to if the roadway changes, and see how the driver's behavior and the pedestrians' behaviors, and kind of see what works long term. So there's some demonstration projects I'd like to do that would be aligned with moving this forward, just and trying some stuff out. Yeah, go ahead, Rod.
This has been needed for some time.
Yeah.
I'm just wondering, is your concept to actually widen the shoulder a little bit, or is it just painting on?
So this one, the one that we have in the concept plan is actually to, it's the same right away. So during, like, for most of this 135 section, actually State Highway owns, like, pretty much from where like Oakland town limits ends, like you have the whole road, like the whole right of way is what's being used. So you wouldn't have to purchase anything, but you would like reduce the shoulders essentially. So the driving space would be the same, but we just provide that. So the space for the pedestrians and bicycles.
So it would look a little bit like 219 at the lake.
I guess it wouldn't. There would also be then some additional space for the pedestrians and bicyclists. So right now, I think of the lake and stuff, you still have those really wide shoulders. So instead, we're just pushing the lanes over to the side and providing that space for our pedestrians. So I think there's a good cross section here that kind of shows what it would look like. I would probably suggest having a little, I think State Highway had some comments about like the placement of these lanes, or even some places where we have enough space to make like a center turning lane, so then you don't have queuing. Because it is still like a major freight corridor, and we want traffic to go through. We don't want to interfere with that because I think that level of service, but having less space overall, typically, like I think psychologically to a driver, it makes you go slower, which I don't know, there's so much pavement out there. It's really easy to go above the speed limit out that way. And which is not great because like we have lots of intersections, you have neighborhoods, you have schools. So hopefully like this will reduce the traffic speeds in this area. So, and hopefully these improvements will reduce any accidents. And
is that really a barrier between the pedestrian and the
so this one is just a grass, like, so it'd be a curb and gutter. So it would like a shoulder more or less, and have potentially that barrier would have trees in it and some other like visual separation between the cars and the bikes and pets. In terms of like maintaining it, I'm trying to work with State Highway since it is their right of way. I'd be like, would you like to pilot a program where you take care of this? So, and the plan is to hand it off since it's in the right of way. They can build it and move it over to the design phase and that part, which is really good. And it would be nice to have the project delivered in that way. But the state is prioritizing complete street projects like this and active transportation projects. So I'm really hoping this is a win for Western Maryland in terms of demonstrating that we need this stuff too. So hopefully we can keep this momentum going or partner with them in terms of receiving federal funding and that sort of thing. I know now it's not the best time to be asking for stuff since everybody's like, our pockets are empty, but I think having these plans in place, and I think the bigger thing is that we have community support and we rally to do this and we have this together. So I think really love to like continue to have the momentum on this.
Well, this has really been needed for a long time.
Yeah.
And I guess the plan is to actually connect the trails that are in
So
and Mount Lake Park.
exactly. So I have funding like in place. Well, I have a grant application for taking care of a handful of bike and pedestrian like design work and also some implementation. So I would like to take this shared use pathway and make sure that we connect it into like Yacht Blades and with like Southern High School and the Woodell Park and the town facilities in Broadford, and connect these facilities and kind of have like a network of greenways that serve as other extensions of the shared use path. So, because right now everybody has to like get in your car to walk somewhere, or it doesn't feel or you see people walking, but it's not the most comfortable situation.
Yeah, that's why this is so important. I mean, the major population center is where we're at right now.
Yeah,
Lake Park, Lockland, and Oakland, and
for sure.
we have trails all throughout the county, but you actually have to get in a
Yeah.
car and drive there. So it's so important for people to just walk out of their front door and get on a trail and be able to walk for whatever they want to walk, 4 miles, 2
Yeah.
miles, 1 mile,
For sure. So I'm
8 miles.
Yeah, so I'm looking forward to moving. This would be like more county and town related projects. The yellow lines, which are like our greenways. It says sidewalk here, but I think we've agreed that it's more greenways and probably not necessarily sidewalks, because if you would do something that's in the roadway, you have an easier time maintaining it and also being flexible about that space. So I'm really kind of interested in getting some experts in here to figure out like what works for us, and also those demonstration projects in terms of like, do we like flexi posts, or like how does this like paint or thermoplastic, how does it hold up on our roadways with our winters and the heat and the cold? And so trying to kind of come up with these facilities that, you know, are easy to maintain and that we can like keep up with, and also like our community like understands how to use them. So that's all part of this. Yeah.
Second connects up to the southern complex. Does it make an effort to connect up to the other schools in the areas?
Yeah, so it does make an effort to connect to Yacht Blades. Bradford was a little out of my range, but I think this is a nice project to be a segue to that other section and also to the other parts of Oakland. And then if there's like lessons learned, hopefully we can apply that to other areas as well. I guess that's a good segue. I have a ton of projects like in the queue. So I'm working on some procurement for some experts to do a master-wide county active transportation plan, and kind of looking at bike, pedestrian, off-road vehicle use, as well as like water trails, kind of take a look at what we have, and then where we can prioritize and build those networks out. Another study in that same grant application or grant funding is a traffic study of Oakland. So clearly, especially when we have the 4th Street Bridge closed, we can see that the traffic in Oakland is suboptimal. So I'd like to have like some traffic engineers and specialists study the traffic patterns and see where we can maybe make some changes with the existing system. And then also what kind of like low cost, easy improvements that we can make traffic flow better and be safer, and also provide facilities for active transportation and the vulnerable roadway users. I think Memorial Drive comes to mind every time I think of this, because like it is.
That's what I was going to ask you.
That, and even like 8th Street here, and I'm like, this is terrible. And I like occasionally you will see a brave soul, or like, or it's last resort really, because I don't think anybody wants to do that, and frankly, it's not safe. So, but there's space, and also I think there's a way to do it that, as much as you know, I think we've had the Oakland bypass like in our minds for a long time, but really, if somebody is like, here, you guys have money to do it, and I have all the support in the world to get it done, it would still take 15 years to actually like have a ribbon cutting. So those projects take a lot of time. I'm hoping we can get something delivered in a faster manner that fixes. We need something now, and like I think that's important. But you know, keep those other projects in mind. So if they happen, then we're not having to like undo a bunch of the effort that we're put forward. So that's important.
So is like I see Mountain Lake Park, and so that area between Oakland and Mountain Lake Park, that's another targeted area, because for people to access downtown Oakland, obviously that new line would be terrific. But
Sure.
as you said, I mean,
So like there's like all of
care providers on Mountain Lake
Sure, like, yeah,
on
this-
Memorial Drive, that people walk to us, Dove Center occupants, all of those. I mean, I see people pushing strollers
Oh,
on Memorial Drive, and it's
and there's no shoulder.
not a good idea.
Yeah, so I would love to have, it would be cool if we had the space or could find the right of way to do something like a shared use path. Also, that would be easy to maintain, like your towns like could take a truck on that and plow.
Yeah.
One swipe, you should be good. So that's a facility we could have open most of the year. So I think that's would be great. I'm also working with the transit, so they actually have a meeting here at 9:30 today, which I'm hoping to hop on. So they have their transit development plan that they're working on. So it's looking at like the next 5 years for transit services. I'll send that in my update report that Shelley can attach to the minutes. And so I encourage people's involvement. They did some public surveys about what needs to be done. So when we're doing these facilities, like I think having that other option of the public transit is important because as much as you're like, oh, I'd love to walk and bike everywhere, it's not always an option. And also, like, we have a big county with a lot of area. Like, I'm a healthy, able-bodied person, and I'm like, I'm not walking all the way there or riding a bike all the way there. So having that transit option really opens up some doors. So it's a piece of the system.
To Brian's point.
Sure.
Memorial Drive.
Yes.
I know we looked at this 15 years ago, maybe it was longer. We were trying to come up with a trail that would go from Health Department, Mount Laurel, all the way to the hospital. And there's existing trails there, you know, around the dam. And there's one property that you have to go through, but you have to get right away. I think that would really help connecting the medical and the health facilities along Memorial Drive and prevent people from having to do that dangerous walk along Memorial Drive.
Yeah.
But that's just that it obviously never went anywhere.
Yeah, I have, I think, some shape files from my predecessors where that goes like up through the hospital, kind of goes around the stormwater feature there and then connects behind the health department. Am I on
Yeah,
the
it's up
right
on
track?
top of the health.
Okay.
It'd be up the top, above the health department, and it would sort of connect right into where Mount Laurel is and go all the way over to the hospital.
Yeah.
So that would link some major
Yeah.
health facilities to the hospital.
Sure.
So
So-
just put that in the wheelhouse too.
Of course, like, yeah, that and like trying to plug in all those pieces. So, yeah, so I'm hoping we can have some consultants on board and they can do their initial studies, like in next summer, spring, and then we can have some public outreach following those evaluations. So really looking forward to that. In addition to that, I guess like, I'll just share with you guys the Oakland Harrington Manor project as well. And, oh, here's some better cross sections as well. So this is what, so the existing roadway goes to here. So we are using some of but this is shoulder that most of it is state highway owned. So we aren't having to acquire on the wider parts. And then here's some other ones and you can see the distance of the existing roadway and it all fits. So then we can still provide the on-street parking in places in Oakland. And then this is the bridge cross section. So this one is, we're built like, so the bridge that they're building right now, wish I was like 2 years ahead of that.
Yeah, they need to put that in right now while we're building the bridge.
But this is, the spec you see here is what is for the bridge, and you actually have like a concrete barrier between that. But it's better than the 3-foot sidewalks that they took off on the old bridge. So, you know, it's you know, it's an improvement. So that's good. And then we also have the Oakland to Harrington Manor. Do you guys want to hear about this one, or I can? Okay, great. I'd be nuts. So we did some public outreach in like last fall, and then the consultants went back, and then we had a public outreach when we provided earlier this year. And so they took us look at several different options, but then they decided on the forest trail. So we had options that went up Fingerboard Road and went through a couple different options, but this one seemed to be the most optimal, and it follows. Let me go up just a little bit, zoom out. Show you. All right, let's zoom in just a little more. All right, so here's like the town of Oakland, the existing trails, the yellow here, and then it crosses the Youghiogheny River. Where that crosses is still to be, like, basically we're like, it can be done. That was the whole, it was a feasibility study. So looking at like, is it feasible? And the conclusion of the report is, yes, it's feasible. So then we'll be working with DNR and our partners to figure out like, okay, where is it exactly? And how do we take care of it? Who takes care of it? Which is a really big question. And then working on the right of way. So we have Town of Oakland property, and then you get into DNR's wildlife management area. There is 3 private property owners that we do affect. That's these yellow parcels here, but we've been in touch with them. So far, we've had verbal confirmation that they'd like to continue working with us through this process. And then it gets into Forest Service property and connects into the existing trails at Harrington Manor. So finding one safe roadway crossing is another one of those like study projects. But the plan is to provide a like easy loop for the residents of Oakland, which would be like a little less than a mile, like 0.7 miles. So you can cross the bridge, do an easy loop, and then come back. And then there would be a 10-mile trail that would get you from Oakland to Harrington Manor State Park. It would be a single track mountain bike trail currently because that reduces the amount of environmental impact. And also a 10-mile trail, we're thinking about the users, like how many people are up for the 10-mile. So regular hikers, runners, bikers. And so trying to work with those, kind of target our user group is important. So you can go through the different spurs, and there is another like loop up here. But we have a couple stream crossings, which make the project expensive. So I've applied for some design funding. So we're working on getting engineers underway and getting those environmental permitting processes so then we can move forward with the construction. But given funding right now, I'd be like, in 5 years, we'll have a trail, but I'm holding myself back. So maybe 10 years we'll have a trail, and I'll say 15, and then I can exceed expectations. So we will see. So, but I think it's feasible, and I think all the parties involved are amenable currently. And so my next plan is to send out postcards to all the property owners in all these project areas and be like, here's the report, please look at it. Love your support. Or if you have any qualms, now it's a really good time to say something, because we're at the stage where we're kind of between funding. So. And then here it goes through the private property, and then we have some switchbacks. We had a couple different options. There was some sensitive areas we were trying to avoid and some stream crossings. So I think we have 2 options here. We need to work out with the Park Service, and there would be a trailhead. We'd probably use the town's parking lot, improve the one by the Chautauqua West, and then improve the trail. There'd be a trailhead like across the Yauk River, just a small one for maybe 5 cars. And then those would be the only access points, and then work with the state park and provide a nice trailhead at their facility as well. So, but so far the Park Service, Maryland Outdoor Recreation, and the Forest Service and Resource and Wildlife and Heritage have been really cooperative and really great partners in the project. So look forward to like us all working together to make it happen, as well as the landowners. They've been really great. They've had good communication. So. Any questions on this? Yeah.
What's happening statewide with electric bikes on these? Because they're rapidly growing in number. And when you're talking about a 10-mile trip from Oakland and back,
that seems like a much.
People can use electric bikes, and then to share that trail with hikers or regular bikers, I don't know.
Yeah, so I think the general consensus is like electric bikes are great because it does open up biking opportunities for people who might not have it. It opens up opportunities for more people to do that activity. But I think governors and speed like are a big factor in keeping them safe. Because yes, you could probably go like 15, 20 miles per hour on those bikes. Granted, going downhill on a mountain bike, you probably really might be able to top out. But I think these trails are not going to be patrolled. Like, so I think it's really important that the users understand like what those limitations on speed are. So I think it might be like a little bit of user education as well as like, yeah, and identifying potential user conflicts while we're in design. The other part is like, there's also a bunch of equestrian facilities here. If we're going, a horse trail is different than a mountain bike trail. So it also want to reach out to them and make sure if they want a facility, maybe we can develop a parallel one. So then we don't have such an impact on the trails. Yes.
Has there been any look at improving walkability to the northern complex, or is that just too isolated?
Oh, to the high school
Yeah.
or that? So that's hopefully part of that bigger countywide study where I can like we can make those other connections. So
Because that would be something that would be suitable for something like an electric bike, because it is kind of a stretch.
that is true. So thank you for pointing that out.
Real quick, I think Dr. Pope's question is very relevant because on some of the trails now,
Mhm.
it'll say no motorized vehicles permitted. So is an electric bike considered a motorized vehicle? Has it been defined as a?
I will have to look. There is like a Maryland like bike committee and DNR has like some policies that they have put in place in terms of electric bike. I guess that is like part of education and signage and like the use of these trails and when we design them. Like I said, I think in most cases, if electric bikes are used like anything, if you use it responsibly, typically we don't have an issue. But it's whenever you're using it like a motorcycle, then you come into user conflict. But let me look into that and I can follow up with Shelley on it.
You know what the cap trail does, they allow, you know,
I honestly, I do not know, but I think it's worth looking at. I'm sure like generally, like I said, if it's a good if you're just using it as an assist to, help you get off hills and things. But if you're, using it like a moped, I think that's a little a different thing. But also like these technologies change rapidly. So I'm really hesitant to like, we got to be careful about our signage. So then we don't have to change it to be like, oh yeah, now we have these hover cars. I guess you could use them because they don't affect the trail. But then you have like people crashing in on them. So I think being thoughtful about the use of it and who you're designing the trail for, and also trying to provide access for everybody. Like an important part of this project is that smaller loop where people can at least go across the bridge that we'll build and then have an experience on the other side of the river and kind of get to appreciate that area.
Yeah, I think like down in Davis, the electric bikes are
Yeah.
on those trails.
Okay.
So I
Do you
see
hear
them.
much like complaint about those?
I've not heard, but I just see them
Yeah.
down there all the time and they're on the trails.
sometimes it's just signage on the trail, watch out for pedestrians. That's all.
Yeah. Or like, yeah, or maybe have some signage saying like, here's the level right away, like always, like, that. And I think, just sometimes you can't hear them or people hike with headphones on and run with headphones on. And then, there's all of those kind of things that I think that's more user education as well. So maybe it's like a shared campaign in terms of like, we allow these things, but here's the guardrails. So.
I mean, yeah, I think Fort Run, there's sort of single trails out there.
Yeah.
Pedestrians certainly use them and mountain bikers.
Yeah. So yeah, you have a little bit of hiking and stuff.
So we haven't had any major accidents out there.
Yeah, but I think it's like I think the other part of it is like making sure we have enough facilities so they aren't crowded and you don't have as much user conflict. So kind of like spreading out that usage. So. Let me see here. I probably have a couple other project updates. So we were awarded funding for Meadow Mountain Trail. So the current Meadow Mountain Trail, it provides for several different uses, but I feel like one, it doesn't get a lot of attention, and also the out and back nature of it, or just like it's a straight line and you kind of drive to it, kind of is less of a draw to people. And then also some parts are for snowmobiles and bicycles, but really it isn't tailored to one group. So I'm trying to I'd like to get a consultant on so we can tailor it to a specific group, make it a good user experience. And then I'd even like to explore maybe some opportunities where we could have some loops or something tight in within those right of ways if the Forest Service and State Park would allow for it.
I'm thinking the surface needs improved so that you can put a regular bike on it.
Yeah.
Ride your bike.
So we do have construction funds for that. So I'm excited to get some folks on board to help out with that. And then we also have some funding to do the design to connect the Grantsville sidewalk that ends at the east side of town to Spruce Forest. So we have design money, so keep that moving, as well as folks in Crellin on Crellin Street. Their sidewalk is crumbling, so we have some design funding and also to connect it to the elementary school there. We're doing some work in Fork Run. Have an intermediate trail funding for construction, but we also have some design there so we can kind of figure out what the next phases of that facility is. And let's see here. And currently the Bloomington Park Community Park, their pavement just about finished up and they'll be getting a new playground installed in early December. So we should have a ribbon cutting and they have some nice facilities for those folks in that community. So I think that covers like the transportation side of the current project. So hopefully we'll see some awards here in the next couple months for some other funding sources. So any questions? Anybody online? How do I know if like we got any questions online, John?
You just hit the stop share.
Okay, very good. All right. Well, thank you for your time. I appreciate it. And like I said, I'll follow up with some notes and some links.
You're about today. Okay.
Thank you, Sierra. That presentation. Our next is Shelley Arbright with the Maryland Department of Health, Population Health and Goals and the Head Model.
Back to driving.
Thank you. Good morning, everyone. Can you hear me okay? Okay. I'm joining you from Columbia this morning, so if the connection gets a little slow, I'm just going to turn my camera off. I just want to thank Sierra for presenting all of that information. She's been working on it for quite some time. We've had a lot of community input, like she mentioned, and it's a really nice segue because all of that policy and infrastructure work truly affects what we're trying to do on a population level with our chronic disease and access to healthcare and other things. So I just want to thank you for coming out, and we will make sure, because we do need everyone to weigh in on some of those decisions that she presented. So watch your follow-up emails so that we can make sure your voices are heard there. So this morning we have some exciting updates from the Maryland Department of Health, and John has our a presentation up. This is from Building a Healthier Maryland statewide health improvement plan meeting that was held on November 12th for all the jurisdictions in Maryland. So this is just a little reminder. We talked last year, it's part of the Building Maryland framework, and the state is fine. It really has developed this framework for us, and our local community obviously does our community health improvement plan. So this slide just talks a little bit about how those plans integrate state initiatives and then kind of flow down and back up. So just wanted to mention they have their kickoff meeting, like I said, and have a new project for us. So
Hey, Shelley. You're kind of cutting out, and I think we lost you all together.
And can you turn the volume down while you're see?
That might be
I'm
part of the
curious
problem.
if she would turn off her
Well,
camera.
it's too
She'd
high.
have more.
You want to try that again? Just the last part, we lost you.
It's local actions, they're small. That should be. Corey. This is
Proportional to the
statewide.
funding.
Ask me after the recording.
That's a state presentation.
Yes, they do.
Okay, Shelley's gonna call in.
They didn't go out and top.
Okay, Shelley, are you with us?
Hello, can you guys hear me?
Yes. Now I'm gonna turn you back up a little bit. This is a little quieter. Okay, let me go back to screen sharing.
All right. So I just called in, so maybe we can, this might work a little bit better. I am in Columbia for our Care First meeting that starts here at 9:30. So we're doing several things, but so the local and state health improvement plans are underway. And this slide that we just started talking about with the gears, just as a reminder of how that works together. So our statewide health improvement plan had a kickoff meeting earlier last week and essentially reminded us of all of our areas, and we'll start having work group meetings with the jurisdictions around the priority areas that the state identified through their assessment. This will dovetail nicely with our community health improvement plan and the assessment that we completed. So we do have a brand new project through MDH. Next slide. And it is, this is a little bit more about the synergy, of course. And next slide. You guys are experts at all of this already. So here's the priority areas from the statewide health improvement plan. There's chronic disease, behavioral health, violence, access to care, and women's health. So those are the main priority areas. And then there are several different strategies within all of those. Next slide. So I mentioned that the state Maryland Department of Health would like all of the jurisdictions to rally around one topic at a time. And so December 15th is the first meeting and where we'll discuss chronic disease, which is the first priority that they've identified. And that meeting is on December 15th, and they're continuing in work group style, and multiple sectors will participate in that. And then we have this new project that is going to layer on top of that, and it's called the Population Health Action Plan. So I think you can go to the next slide, John. Yeah, this is just a few things that are happening in the work groups. We can go to the next presentation. Essentially, we've all been waiting on the AHEAD model and the rural transformation information. And in September, we worked on feedback for the state for the RHTP kind of information. So you guys were really helpful in getting a lot of information to the state to be able to respond to this meeting. And so I presented the health improvement part of the plan first to the state, and then it kind of rolls in to this other piece because we need to make sure that we have alignment so that we can continue to have funding. And so this Population Health Action Plan is MDH's way of working with each jurisdiction in Maryland to ensure that there's alignment. John, on my screen, I'm still seeing the SHIP slides. I don't know if you can pop over into the other presentation. There we go. Thank you. So this was also presented last week, and we're going to go over it briefly. Just go ahead and I think it's slide 3. just to talk a little bit about what the AHEAD model actually is and how it integrates with these other plans. Next slide. So it's Maryland's participation. Basically, the AHEAD stands for Achieving Healthcare Efficiency Through Accountable Design, and it's through the Center for Medicare and Medicaid's innovation model. And so our state of Maryland obviously is signed on. We're in cohort number 1. And in order for us to implement the AHEAD model at a local level, we need to develop this population health action plan. And it has to align with a population health accountability plan that essentially was given to the Maryland Department of Health by the Centers for Medicare and Medicaid Innovation. Okay, if that's not confusing enough. So a lot of different plans that basically all it means is that we just have to make sure they're aligned. So next slide. Okay, so it's based on this population health accountability plan is based on a template that was provided by the CMMI, and they basically gave a very narrow range of measures. There are 6 domains in this population health accountability kind of template model. The first one is population health. The second is prevention and wellness. The third is chronic conditions. The fourth is behavioral health. And 5th is utilization. And there's a 6th optional domain area that is blank. So Maryland took those domains and the measures that they had to choose from and gave us options to choose from based on how they were going to address the AHEAD model and try to tie in the rural health transformation funding. All right. You will notice the last bullet there talks about if Maryland fails to reach our targets, it triggers a corrective action plan. So that is, we're not sure what that looks like yet, but that is something to note. All right, next slide.
We link this to the federal level. Who at federal level is sending this down to us, and then Maryland is trying to comply with it? Someone at the federal level is sending it down, and if they stop sending money, what's the point?
Shelley, did you hear that?
I did hear that. That's a great question, and I think the Maryland Department of Health is doing an amazing job trying to organize all the jurisdictions with a really quick turnaround to be able to respond in a way that is organized and, with our data so that we are poised in the best way. But it's certainly something that no one has the answer to, Dr. Pope. But we are moving forward because we are, it has been stated that we're slated to receive, the state of Maryland slated to receive significant funding. So we want to be ready when that happens. And if it doesn't happen, we'll have to figure out what's next. Is how I understand it.
Yes.
Or do they have other money?
It's the evolution of the total cost of care model. So this is
What?
the total cost of care model that we have been using for quite some time. So this switches over in January.
Congress has put money into this?
This is the Maryland model that is being rolled out nationally. So the total cost of care that regulates the hospitals in the state of Maryland is rolling out nationally. I believe there's 7 or 8 or 10 demonstrations.
There's quite a few, yeah.
Across the country. So yeah, from a health provider standpoint, we've been doing this for 10 years now. We've been doing this for longer. So for Maryland, it's quite not the big shock that is going to be others. All of these metrics that we've been doing, the hospital's been doing. Now it's just going to throw the net out a little bit wider to collaborate with the other primary care providers and other specialists, et cetera, across. But this is nothing that we're not doing now. It's just expanding this nationally. So the dollars, what that means for our reimbursement system in Maryland at the hospital level and the collaborations, there's an opportunity to collaborate more, but it's not particularly disruptive to what we're doing right now.
Until we get the corrective action plan, which is the new piece.
Yeah, to that point, the corrective action is, there's always been that in place in Maryland. There's been carrots and sticks in Maryland to comply with all of this stuff. It's no different than what we do now.
Yeah, we just committed to a little more. So, and it's an elective model. So the innovation models.
Committed to doing what we're doing. That's kind of, I hate to simplify it, but fear not, we're doing this now.
At Mountain Laurel.
No, I'm saying that all the Maryland hospitals have been doing this for 10, 15, 20 years already.
Is the money coming out of hospital charges?
It's part of the charge, the reimbursement model that the hospitals have been under with CMMI for 10, 15 years now. So it will look at how to fund hospitals, again, through the Rural Transformation Grant, through how their total cost of care model works. But it doesn't necessarily impact, it's more of an impact on the hospitals and an opportunity for them to partner with the primary care. It does not impact Mount Laurel and their reimbursement. It does not impact Wellspring's reimbursement necessarily. Although we all participate in something called Maryland Primary Care and DPCP, which is wrapped up in this too. So there are primary care elements, there are hospital elements, but it's what we're doing now.
Thanks, Brian. We'll just keep moving forward, John. So the local health department role in this is basically for us to create a population health action plan to take some of those measures and highlight our role. And when I say our role, I mean the collective community. And that's how we've always done the community health improvement plan. So it's just another layer within the systems that we've already been working in. Next slide. So they do want us, excuse me, they do want us to, like they always have, conduct community outreach and to understand desired solutions. They want us to do root cause analysis, and they want us to just make sure that we're connecting with every population that we can. And then, of course, it has to align with this accountability plan, which the state, Maryland Department of Health, is helping us do. Next slide. So here's a sample of the Population Health Action Plan template. It's very basic. You've got, your measure at the top. That's what they're calling a measure. So broadly, that's the domain or the priority area. Then you've got your objectives, your data, and any type of root cause. And then you've got your ownership, the activities, and kind of down through your strategies, your timeframes. So everything that we already look at, this is just a sample of what they want. MDH wants the action plan to reflect as far as formatting goes. Next slide. They did give us some funding to be able to do this. So we do have a year, and our baseline is 80,000. You can see there we have some options as far as working regionally, working with other hospitals, and we will need to submit our stuff by the end of the year. Next slide. Here's a timeline. So we have to submit our local planning budgets, and then we have an entire year to complete this new population health action plan. Next slide. And then this is a little bit more about the rural health transformation. Next slide. So if you remember, in September, we had that meeting where we all chimed in on the different areas. So this is from the One Big Beautiful Bill Act that was signed in July. It is being administered through CMS, and you see the bulleted goals there. To make rural America healthy again, sustainable access, workforce development, innovative care, and tech innovation. Next slide. Maryland submitted, so this is an example of what we're talking about as far as funding, potential funding is 50 billion over 5 years. So this is just sort of bulleted language. But the funds will be distributed from 26 to 30. Just an idea of the scope that we're talking about there. And then next slide. We did this already. So this was something that we did in September. And we had through the Health Planning Council, we did that through the local management board, several agencies, different units, individuals actually were able to submit proposals and weigh in on all of this discussion. And then next slide, Maryland came up with what their proposal based on all of that feedback was. So their initiative is to transform the rural health workforce. That's one. The second one is the promoting the sustainable access and innovative care models. And then the third is rural Marylanders to eat for health. So food insecurity. That was submitted on 11/4. And it does say that it includes all state designated rural counties. And if you want to skip through, there's a map. We can skip through that. And they're just talking a little bit more about the first slide, the nutrition education, mobile health. They also are looking to fund projects focused on expanding services for appropriate care delivery, and then, of course, behavioral health. So last slide here. Our funds basically are used, they want us to improve capacity and processing for improving billing and maximizing revenue generation. And so there's just a couple other things to consider. And like Brian mentioned, it's a nice pivot point. Everyone had been waiting for quite some time for the actual signature. I think Jennifer's in the room and she can talk about that. So this is pretty hot off the press for us. And it's just a way for us to be able to pivot, like I mentioned, and be ready as a community and ready for those larger initiatives that we want to see funded in the priority areas and the larger domains that they've identified for us, which really do coincide with our own domains here and what's been identified across the state. So what we really need to decide is how we want to work together as a health planning council, a local LHIC, to work on our new action plans. So we have a meeting Monday afternoon with Maryland Department of Health to learn a little bit more about what that expectation is for us and get into some more of the details. But there's been a couple different discussions. If we follow the model that MDH is setting forth and do like topic areas where we start with chronic disease and as a community dig into each topic area as the year unfolds, or we want to have more meetings and create work groups. We can do it all at once through work groups and different topic areas. And so just going to kind of open it up for any discussion about how you all feel you want to move forward with this. And again, our community health improvement plan, that's what we'll be doing as we do this this new assignment from MDH. It's called something different, but essentially it's the same work. So does anyone have any thoughts about just having the Health Planning Council be more of a working meeting or a portion of it to be a working meeting where we dig in a little bit more on some of these specific objectives.
Hey Shelley, this is Brian. As a suggestion, literally at 10 o'clock, myself and our leadership team is working on Mount Laurel's plan around all of this stuff. I understand at the hospital level that every Maryland hospital had to submit a population health strategy to the HSCRC. So the hospitals have already done this. That, suggestion is that we look at this plan and what are the aspects of the plans, and then ask the people who are participants to bring what their plans and how they align to all this stuff. Because we're all doing some of this stuff already or putting together that plan. So ask us all to bring our plans to the Health Planning Council so we can align all this up would be a suggestion.
Be a great place to start.
Yeah, well, it's always good to put something on paper and then have people react to it as opposed to.
It says start with blank page.
Yeah.
For sure.
And we will all have that. We actually have to have that. So not to do the work, but actually just to line up, okay, what is the hospital's role? What are the primary care's role? What are the specialist roles? Even, the long-term care, home health, we have to wrap together all these continuum of care throughout the county and figure out how we're all going to be part of that.
Mm-hmm.
Network of care plans from 10 years ago. I'm gonna stop sharing here.
Okay. Oh, okay. Thanks, Brian. So does anyone else have an opposing idea or that makes the most sense to me. And we're happy to do that. But does anyone have any other way they'd like to do it or any other thing that we should entertain? Okay, I don't hear anything. I am by myself in a room though, so it is a little awkward.
Hey, Shelley, this is David Stewart. Do we have a timeline sense yet? Like I spent some time reading the entire narrative that was submitted for the rural health transformation, and there's just a lot of things in there that are unclear to me in terms of implementation. And I'm just curious if we're getting any kind of a clearer picture of some of the actual more concrete details, obviously, and do we know when we're going to find out how much Maryland is actually awarded?
We should,
Oh, I think
they're
Jennifer-
supposed to tell us by December 31st. They're supposed to tell MDH by December 31st how much Maryland has been awarded.
Thanks.
And they specifically stated, one of the slides actually said it on there, the way it's broken out, you got the 25 billion and 25 billion. They don't see Maryland getting much of that second 25 billion. They actually state right there that Maryland is not particularly competitive for workload funding. So they're not banking on the $200 million. They're banking closer to the 100 million.
How does that compare to like the regular funding, like sources or like previous bills?
Well, this is kind of brand new.
This is brand new.
So yeah, this is just added on to
Added
it.
on to it.
Yeah.
Okay.
Yeah, these are additional dollars in addition, on top of what we're already getting. So.
And John, if you go up to the slide where it shows the three pots.
They're planning and implementation. So it funds implementation of new technologies. It funds,
That one.
if we want to open up a school-based health center in Northern High School, it funds that. It can be for a lot of different things.
Infrastructure.
Around, as long as you can link it back to health.
Okay.
Yeah, so like Initiative 1 for Transforming the Rural Health Force, their budget for $200 million a year. The first bucket was right around 140 million.
The initiative 2 was like 765 million was in that bucket, and initiative 3 was about 88 million. And initiative 3 is a lot on food as medicine. Not just food insecurity, it's food as medicine.
So are you given an amount to work with this money, or is it going to be competitive with?
A lot of it
whatever
will be
rate-
competitive. They are anticipating putting out a lot of RFPs. They have identified in the proposal, they identified several organizations that will receive automatic funding. Some of it is LHDs, a lot of it's rural Maryland. The Rural Maryland Council is getting a lot of that.
They do grants for them.
Yeah. So they're pushing it out to the other entities that then can push it out further.
It's a managed grant.
Yes.
I mean, the hospitals, obviously the health systems, imagine University of Maryland, Hopkins will be eager, and then the other entities, the FQHCs, the primary cares. It's got to be fair, but there's going to be a managed grant.
And so if Maryland's awarded this January 1st, they have 1 year. There's no carrier for this funding. If they get $100 million that year, it all has to be spent that year. And if they don't meet their goals, the performance measures that they set, the federal government will claw it back from us and give it to someone else. So it's going to be a big push to get it out and get it moving quickly. And so you'll look at like the red circle, immediate impact. So they have things that they can get done now in order to spend the money. And then the part 2 is the transformation funds. It's stuff that will take longer and set up.
Well, we're probably in better shape than most states as far as planning that's already been done.
A lot of it. It's just that we
just have to figure out what can we use the money.
yes.
So which one? Push smarter. And here's an opportunity.
Okay, we are to agency updates. I'll start in the room here first.
I did one. So last year, the legislature started an adult vaccine program, and we were one of the 4 pilot counties that just received funding through that. And we got RSV vaccine, Shingrix, MNR, and Prevnar 20 doses. But that is now live across the state. There should be a press conference later today about it, but just let you know that the vaccines for adults program is up and running.
How will that be implemented?
They are sending out vaccines. Like I said, we got those, and
By health department.
we are putting them out into people's arms ASAP is what we've been told. Get the shots in the arms.
And privates, are they part of this? Are they,
As far as I know, it's any LHDs.
what?
As far as I know, it's LHDs, but I'm not sure yet. I'm not sure yet. Maybe the press conference may
Or
make
it's
that
for the
more clear.
clients. The clients choose whether they get it from their own doctor or from the health department. But there's no subsidy for for private immunizations.
I don't know that for sure. I just know that LHDs are getting it.
Well, you can get the vaccine, but how do you get people to take it? It's a question.
Well, that is true. But the vaccine's available.
That's a vaccine. Some of them have
That's not the
pretty good
problem
reactions.
here.
It's not mandatory. It's a lot of people still want them. So
At least it'll provide free vaccine to the people that want it.
Yep,
No income guidelines.
correct.
So that's all.
I have a couple of quick updates, just from personal health. I wanted to kind of highlight that we're now offering services at Garrett College. So for the students on campus, which has been huge because in the past when we were not offering services there, they would really only go to urgent cares, especially those students who are from inner cities and are not familiar with the area. So now we are offering our family planning services there, STI testing, but we're also doing general health, access to services, and immunizations as well. We are also seeing clients that are not enrolled at Garrett College
at that location. So if there is a client who would be preferred, to see on that end of the county instead of coming here, Jess Carey and our other nurses are willing to see them as well.
Are those nurse practitioners?
I'm sorry?
Are those certified nurse practitioners that are giving those services?
Yes, there's a certified nurse practitioner and two nurses.
Two nurse practitioners.
One is a
Practitioner,
nurse practitioner.
two nurses.
Two nurses.
Sounds like primary care focus.
Not necessarily, no. We do actually help get those students referred to primary care. Again, especially those students who are not from the area, so they don't know where to go. And the urgent care is the closest facility to them. So if they come in for annual women's health or for any contraception, STI testing, anything like that, we will do some general health things like hemoglobin and blood sugar testing, but we'll get them connected to a primary care provider as well. We have a list that we refer them to. And if they also don't have insurance, we can help get them referred to insurance as well.
It's like one site school health.
Yeah, kind of,
Like
yeah.
Frostburg has.
Yes, it's exactly what we were doing at Frostburg State University, but they, I believe, got some funding to do Title X services. So we're no longer at Frostburg. We're now back at Garrett for those students. So any other questions about
Is that test Title X information?
at Garrett College?
Yes. Yeah.
Right? Yes.
Yes.
That's one of the ones that's being cut, isn't it?
No, it was not that. We were fully funded.
It was threatened.
Yeah, we had a temporary delay in receiving the funding, but we were fully funded.
Other
The
update I just wanted to
question is,
give.
what are the hours for the college?
Currently right now, they are only there on Thursdays, but I will give an update as soon as I can because they may be switching the days based on student availability for those services. So I believe the Dove Center is there on Thursdays for student services. So they may be trying to kind of collaborate with them, but there's talk of them moving to Mondays. Which day of the week might be better? They're working with Shelly Manier, who is the coordinator at the college. So right now it is Thursday, 8 to 4:30, but we may be switching those days. So I will give an update as soon as I can about that.
Where do you provide services go?
Oh, good question. They're in the CARP, actually,
CARP.
in the CARP, yes, right. There's like a clinic space. If you walk in past the front desk, it's to the left and there's a big sign that says where it is. Good. Other update real quick, just wanted to give a quick one about CPES. That's our cancer screening program. We have seen a large increase in referrals from Wellspring Family Medicine in the last few months. We've been trying to advocate that everyone, regardless of insurance status, be referred. Just go ahead and refer every client that you can for services. And then I will determine if they're eligible for enrollment. So that has definitely helped bring our referrals up.
Just a point,
Yes.
you refer them then to the private doctors who provide the service.
Depending on which screening they need, yes.
But
Yeah.
colonoscopy is totally privately provided,
Mhm.
but it depends on a referral and funding from CPES program.
Yes, that's where my determination would come in. So if they refer a patient to me, I'll contact them, ensure that they're eligible for program enrollment based on, what the program requires them to be, criteria they have to meet, for lack of a better phrase. And then I will refer them to one of the colorectal providers in the
But
area.
it is a private physician provided service.
Yes,
Once
and
they get
CPES.
qualified, so if your income allows it, then the county will, the state will pay for that. And,
Yeah, that's correct.
but the providers have all agreed to accept what the compensation has been by the state, so they're all cooperating
Yeah.
with that program.
Yep, all of our colorectal providers and general surgeons in the area have agreed to contract with us.
So this is really, Medicare is covering most colonoscopies and that type of thing. So this is primary to people that aren't insured or don't have.
Well, if there aren't insured, we cover everything at 100%. Medicaid will actually cover most screenings at full cost. Medicare will cover something that is coded as an actual screening. But if you have a colonoscopy and biopsies are taken or polyps are removed, that is then coded as a diagnostic procedure. So Medicare will not cover the pathology fees or associated. Yeah. So we'll pick up, we're a payer of last resort, so we will cover those last costs. So even if they have Medicare, if they are still income
They'll have to
eligible,
do the diagnostic.
if they're income eligible, they're still enrolled in the program. Yeah. And actually, a lot of my clients are Medicare based because I don't know many colonoscopies that are being done where biopsies are not performed.
So it's mainly the lab tests. everything.
Yeah, lab tests, sometimes the co-pays are not covered for odd reasons, or there's a few dollars associated with, facility fees. Good questions. And then the last thing, just wanted to highlight our lung cancer screening module. I know in previous meetings, we had talked about launching that. It is, fully live right now in our cancer screening program. Our measurable goal for our first fiscal year of instituting it was to screen 3 people. We are 4 months into the fiscal year and I have done that. Whoop, I already met that performance measure, and I have 6 other people scheduled for lung cancer screening. So that has taken off and it's doing pretty well. And luckily, no one has been positive.
What's the criteria for that? It's screen we have to.
The lung cancer screening.
Yeah.
The U.S. Preventive Task Force recommends you have to have a smoking history of, I believe it's 20 pack years, and then you have to be at least 50 years old. If you're not a smoker, I've had a lot of people call saying, you know, they've had a history of secondhand smoke exposure or working in the coal mines or things like that, but that's actually not criteria for screening. You have to be a smoker. That's all I have.
We're in greater risk.
How much lung cancer is there in Garrett County? Do you have an annual
I do not
new
know.
cases or anything like that?
I do not have one, no. Haven't done a study year on that yet. On the incidents in Garrett County.
That information is available. I'm sure.
In the community health assessment, we have the incidence and the prevalence.
Of lung cancer?
And in this one, we also have it broken down by zip code. So for all kinds of cancer, yeah.
Can you spew out what the numbers?
I don't have it off the top of my head. It's a 2,000-page document, so I'll have to look it up for you. Dr. Brown.
But just a quick update on the 360 Access Hub. We are open. We opened November 12th, seeing guests. We were able to, though it's by appointment, you go to 360accesshub.com/help. Anyone can use that form, can help anyone else, refer them in. Our team contacts the people that are submitted the form, and we had 72 forms come in. We were able to make contact, and 68 people, I believe, 68 people kept their appointment, came in, we were able to serve them. They received recipes and all the ingredients to make the recipes, and then additional food items. And then, so we were able to serve them on the 12th, and then the 14th, we had a second day of appointments. We also had the first donation drive where we were able to restock some of the shelves based on just our community's generosity. And this week, the other portion of the 360 Access Hub through Maryland Physicians Care, they worked with volunteers and are packing boxes for the clients that Maryland Physicians Care selects into the program that they're running, and utilizing 360 Access Hub to basically as the grocery delivery model. So we were able to work with 9 volunteers. It was an incredible first week. And remember that you can share that form. You can sign up. You can sign someone up. And so that will just continue by appointment. And it's working pretty well so far.
Anyone else online have a update? David?
Yes, just a reminder that it is open enrollment for health insurance through January 15th for the Maryland Health Connection side. For folks that are 65 and older, Medicare open enrollment ends on December 7th. I just like to make that distinction because sometimes people get that confused. I will say that what we're seeing is if you're under 400% of the federal poverty level for a single person, that's $62,604. It's relatively okay. But if you're older and you're over that 400% of FPL, the costs are pretty astronomical. For some of the folks we talked to, it's like 20-25% of their income, because for 2 people, the premiums can be anywhere between $1,500 and over $2,000, depending on age. So just, it is open enrollment. Encourage people to talk to navigators, to go to Mount Laurel, to give us a call. That's all.
Anyone else online?
So
Oh, sure. Go ahead, Thomas.
just wearing my Lions hat for a second. Lions clubs in the region now have access to a mobile screening van, which, you know, will do vision screening, but we'll also do some
Screening?
vision screening,
Vision
but we'll also do, I believe, blood pressure checks, that sort of thing as well. So, just contact your local Lions Club. I'm sure they're happy to help make it part of any, you know, event.
So it's an event-based idea? Or
Yes.
it's for schools or
They can
for
take it
community
wherever.
groups or?
Yeah, they can take it wherever. I can put you in touch with the guy who runs it if you'd like.
Vivian?
Hi, yes, I actually just wanted to say with Medicare open enrollment, community action is actually full. We are booked up through December 7th. So what we're doing is we're referring everyone to call 1-800-Medicare.
Thanks.
Anyone else?
I have the
Oh,
one
John.
data. I was gonna go ahead and get that real quick. So, according to the most recent data that we have for the 5-year period ending in 2020, so we're not in this normal data. And it runs on 5-year averages. So we should get a new data point in 2026, running through 2025. The average number of annual new cases for incidence for lung cancer specifically, so isolated just to lung, not lung and I think it's bronchial probably, is 90 new cases across Garrett County, which makes our cancer incidence rate 37.2 per 100,000. And Garrett County, a lot of the data by zip code is suppressed, particularly for the smaller zip codes. But regionally, Lonaconing and Frostburg have the highest rates in the region.
Okay.
And there's a whole bunch more data.
Thank
Your
you.
mind is in the box.
I'll get it for you.
No, you got it there.
No other comments for agency updates. We will adjourn the meeting, and please note our next meeting is December 18th here. Thank you.
That's the other week that you find it.
I wonder if you get diagnosed